Hi everybody, this is Neha Kukreja and I will be doing my presentation on diversity issues in group psychotherapy along with my group members Nikia Kali Felipe and Daniel Bell. I would like to start with this research that I came across by Ibrahim and Lauer, who stated that a major assumption for culturally effective counseling and psychotherapy is that we can acknowledge our own basic tendencies, the ways we comprehend other cultures, and the limits our culture places on our comprehension. It is essential to understand our own cultural heritage and worldview before we set about understanding and assisting other people, which is very important when it comes to knowing our clients or culturally diverse clients in our setting. So, every counselor, every facilitator needs to know at least about their own culture, the history of their culture, the heritage, before taking in the culturally diverse group of clients. Another important thing that I notice is that it is very important for a counselor to take up responsibility for the multicultural group, and they need to, as a part of the responsibility, they need to realize that what is regarded as good in one culture may not necessarily be seen as maladaptive or equally good in other cultures. Since counseling occurs in a cultural context, the meaning of counseling and the role of counselors may vary across cultures. So, in certain cultures, especially in Dubai, since counseling is still starting to develop, psychology is still developing. It is seen, counseling is seen as thing for people who are psychotic or who have issues with their mind or brain, and they need the people who need to see a psychiatrist. Those are the kind of people who go to a counselor. Very few schools, you know, encourage students to go and see counselor whenever they have any emotional or dilemma or psychological dilemma where they have stress or anxiety or such related issues. So in Dubai, it's like if you ask a person, if I tell a person that I'm doing counseling psychology, oh, you're doing psychology, you're doing counseling psychology, which means you can read minds, which means you can see, treat people who have, who are crazy, who are nuts. So this is how our culture is. Whereas when I saw Western culture, people were actually aware about, even the people who were basically working in cafes or waiters, they also knew what counselor's role was. So it's very different when it comes to UAE or Middle East about counseling and psychology, as opposed to the counselor's role in Western or European cultures. Another thing I notice is what is viewed as healthy and adaptive behaviors in Western culture may be viewed as harmful to the family systems in other cultures. Now, let's say in Western cultures, sex or also about going to speaking about going to a bar and having a drink whenever you're stressed is considered as stress relieving or healthy, and whereas in the other culture, whereas in Indian cultures or UAE cultures, that's not the case. That's really considered as unhealthy. Drinking in a bar when you're stressed is considered as unhealthy and not good for health. Or having sex when you're stressed, or just simply to maintain a good health, is also considered as unhealthy. It's not considered for good health. Similarly, in collectivist groups, preserving family harmony is possibly more important than fulfilling personal desires. For example, let's say a girl, basically from a Asian culture or basically Indian culture or UAE culture wants to go out to study in another country for her further education to get have a good future. Now, either mostly her desire would be suppressed because that's considered as not so family friendly, because she would be going away from the family and maybe something could happen to her, or maybe her the way she looks at her own culture might change, and that those are the fears of her family members in the Indian or UAE cultures. And if you look at that same thing from a Western perspective, the Westerners treat, or the Europeans kind of treat the children's desires of getting a better education and having a great future and success in their careers as a good thing, as something healthy to accomplish. Because when a girl raises her voice to speak in Indian or Middle Eastern cultures about her desires of wanting to go ahead and study and educating herself and having a good career, it will be suppressed, or they would say that okay, if you really really want to go and get educated further, you need to first get married and go ahead and do whatever you want to. So even if the girl doesn't want to get married, she has to, because she wants, her main goal of desires is more important to her than family harmony, but then she has to because the family forces her to do, because for her family, the harmony of family is more important than her desires. So that all these things a counselor needs to look into, needs to be aware about all these cultures and how things are perceived in different cultures when they're, and being sensitive towards it all when addressing in the group sessions of culturally diverse clients. Similarly, research conducted by Riley, Little, Hill, and Lee um, made helped them to realize that it is very important to have 5 criteria for attainment of multicultural responsible ethical assessment and behavior. Um, there was this interesting quote that was mentioned in the research paper by them, which stated that making ethical decisions in multicultural counseling and therapy is a professional's multicultural responsibility. So the 5 criteria they outlined are: firstly, examining one's philosophical assumptions about culture and ethics and making these assumptions explicit by, for example, identifying racial stereotypes and biases within oneself and considering how these assumptions affect interactions with clients. Now, as a counselor, it is important that they examine one's philosophical assumptions, become aware about it, about culture and ethics, and make see how their assumptions and their understanding and perceptions could actually possibly affect the other person and their feelings. For example, if a counselor supposedly has issues with Chinese accents and they find it funny, they need to be aware. Maybe they might not be consciously aware that they find it funny, but they need to, before going to a session as a facilitator, they need to be, and knowing that they'll be having clients who will be Chinese, they need to first observe the behavior about and their assumptions about how they see the client as, how they might perceive their inner emotions and their thinkings and thoughts and about that particular culture of client and their speaking style and body language, etc., and how that could affect the client, how their behavior and body language about towards the client could affect the client. So all this they need to keep in mind and need to take into consideration before looking into the client, before taking the group sessions, which involves all of the clients of different diverse cultures. Also, examining alternative philosophical assumption that one may hold about culture and ethics, for example, becoming more knowledgeable about racial and feminist theories. So you need to become as a counselor. One needs to be um, more aware and more attentive towards the alternative philosophical assumptions that one may hold about cultural ethics, as the example suggests. Moreover, increasing one's understanding of the ways that culture is always relevant in counseling and therapy, maintenance of this view may help the practitioner to recognize the salience of cultural issues in the therapeutic relationship. So, in a counseling and therapy, the culture is very important and relevant. Having different cultures is very important. Now, let's say, as I mentioned in the previous slide, how different cultures may perceive different indifferently how the counselor or psychologist behaves. How I mentioned about the Arabs or the Middle Eastern or Indian population perceives the counseling and psychology field and how it is actually um, used worked at, how the field actually is in the Western European cultures and how it actually is in our culture as well, but how people perceive it in the other way. Another point is that the counselor must always develop complex and creative thinking skills about multiculturalism and ethics as opposed to more rigid or inflexible problem solving. So, if a counselor has a client who is from Italy, and Italians like to speak a lot, even Spanish people love to speak a lot in the most of the clients from Italy and Spain, people from there love to speak a lot or love to have a conversation that has a back and forth communication and a long one. And if there are other clients who find that disturbing from other cultures, the counselor would have to be creative in solving that issue and kind of explore in other ways of getting those clients to talk and letting the other clients from other cultures speak more and see how the things work out. Lastly, making an emotional investment in multicultural responsibility that would take precedence over intellectual or professional investments. I also came across some intervention strategies for working across different cultures in group, and here are the few of many I found. Firstly, awareness and respect for religious differences and spiritual differences. Now, in many cultures, I've seen that there, specifically, if you look into even Middle East, there is Egypt, Jordan, there is Syria, Lebanon, so many different UAE. There are so many different places and countries or states in UAE and Middle East itself, where people have different spiritual backgrounds and different religions that they believe in, such as there are Christians and Catholics in Lebanon, Jordan, and such countries, and also they have different ways of praying in such countries. Muslims, of course, have very same prayer style in all of them, but however, the other people living in the same country, speaking the same language, have different cultures as well. They're not all Muslims. So respecting, if there was a counselor doing a group counseling in one of those countries, they would have to respect the other clients' religious beliefs and spiritual opinions as well. And also let the other clients respect it, teach them to respect or help them respect it. Secondly, valuing bilingual and other languages as opposed to viewing them as an inhibition to group work. For example, Sue and Sue state that clients who do not speak standard English, have pronounced accents, or have limited fluency in English may be victimized in therapeutic environments. So, if let's say clients, um, for example, um, if there is someone who speaks Chinese and has a very different, and also speaks English, and they speak English in a Chinese accent in the group session, the group members might find it difficult to understand their accent because never heard a Chinese speaking English much, or they don't really come across Chinese speaking English much, and they find it difficult. So here, the counselor could help them by getting the clients to ask this particular client with the Chinese accent speaking English to repeat it a couple of times so that they can get a hang of the accent. Furthermore, in one of their studies, Carmo found that Arab American clients who present as dependent, indecisive, or nonverbal emotionally, that is not emotionally expressive, may be labeled as resistant because they do not exhibit behaviors valued by mainstream US society. In contrast, others emphasize that within group differences are greater than differences between ethnic groups. So basically what they mean here is that, like I spoke earlier, here the counselor could bring about some creativity, creative thinking, and get the clients to all do different kind of group games to bring about in the group therapy, do some improv exercises or anything else that could help the clients get a better understanding of each other, and also for the Arab American clients who do not verbally express their emotions to um, get to express in other creative ways. So does not necessarily mean they're resistant if they don't speak their emotions out in words. They could probably have other ways to expressing themselves, but that's how they were labeled, and that's why people need to be culturally aware.